Structural heart defects affect both newborns and adults, impacting blood flow, oxygenation, and cardiac function. Recognizing symptoms early and providing appropriate interventions are key to improving outcomes. Let's break down the most common structural heart defects in both adults and pediatrics and what nurses need to know. In adults, aortic stenosis, mitral valve prolapse MVP, and cardiomyopathies are the most common structural defects. Aortic stenosis occurs when the aortic valve narrows, restricting blood flow from the left ventricle. The classic SAD symptoms syncope, angina, and dyspnea develop as the heart struggles to pump against resistance. Severe cases require aortic valve replacement AVR. Mitral valve prolapse MVP happens when the mitral valve leaflets bulge into the left atrium, sometimes leading to mitral regurgitation. Patients may be asymptomatic or experience palpitations, dizziness, and a mid-systolic click. Treatment depends on severity, with surgery for significant regurgitation. Cardiomyopathies affect the heart muscle, leading to poor contractility and heart failure. Hypertrophic cardiomyopathy (HCM) thickens the left ventricular wall and increases the risk of sudden cardiac death. Dilated cardiomyopathy (DCM) causes ventricular dilation and weak contractions, often requiring beta blockers, ACE inhibitors, or implantable defibrillators. For children, congenital heart defects are among the most common birth abnormalities, requiring early detection and intervention. Tetralogy of Fallot includes pulmonary stenosis, right ventricular hypertrophy, an overriding aorta, and a ventricular septal defect VSD. The classic sign? Cyanosis and Tet Spells, sudden hypoxic episodes triggered by crying or feeding. Nurses should place the infant in a knee-chest position to improve circulation. Coarctation of the aorta coa is a narrowing of the descending aorta, leading to higher blood pressure in the upper extremities and weaker pulses in the legs. Treatment includes balloon angioplasty or surgical repair. Atrial septal defects (ASD) and ventricular septal defects (VSD) cause left-to-right shunting of blood, increasing pulmonary circulation. Large defects can lead to heart failure, murmurs, and poor weight gain in infants. Treatment varies from monitoring to surgical closure, depending on severity. Quiz time! A newborn with Tetralogy of Fallot suddenly develops cyanosis and tachypnea during feeding. What is the priority nursing intervention? You got it! Place the infant in the knee-chest position. A Tet spell occurs due to decreased pulmonary blood flow. The knee-chest position increases systemic vascular resistance, improving oxygenation. Next up, a patient with aortic stenosis reports sudden syncope. What is the nurse's priority action? It's an easy one. Check blood pressure and pulse. Syncope in aortic stenosis suggests poor cerebral perfusion and a high risk of sudden cardiac death. Immediate assessment is critical. Remember, structural heart defects require early recognition and careful monitoring. Whether congenital or acquired, nurses play a key role in early detection, intervention, and patient education. That was a lot, but you got this! Watch the shorts reel for quick topic breakdowns. Yes, you can! Master nursing care for structural heart defects.